In this short story of Arjun and his uncle Mr. Ram, we will explore the different types of hemophilia, its clinical characteristics, and the management options available. In a small village in India, a young 8-year-old boy named Arjun lives with hemophilia B. Despite the challenges posed by this condition, Arjun is an active and adventurous child who enjoys playing football and spending time outdoors with his friends. Such a brave boy you are, Arjun. You know, I suffer from similar condition since my childhood. It is called hemophilia.
What is hemophilia, uncle?
Hemophilia is a bleeding disorder, a genetic condition characterized by the body's inability to clot blood properly. It is caused by a deficiency or absence of certain clotting factors in the blood. This leads to prolonged bleeding, even from minor injuries, and can result in serious health complications if left untreated. Here is how it works. Your blood travels through your body in tubes called arteries, veins, and capillaries. Normally, when there is a tear or hole in one of these, bleeding starts, and different cells of blood go to work. To plug the hole, blood cells called platelets gather at the opening, and other blood parts, called clotting factors, help hold the platelets together to form a clot that stops the bleeding.
Uncle, does that mean my blood has something missing in it?
Yes, Arjun, everyone requires clotting factors 8 and 9 for the blood to clot and stop bleeding. Don't be depressed, Arjun. Hemophilia is often referred to as the royal disease because it affected the royal families of England, Germany, Russia, and Spain in the 19th and 20th centuries. Queen Victoria of England, who ruled from 1837 to 1901, is believed to be the carrier of hemophilia with factor 9 deficiency.
Really, uncle? Now I'll tell my friends at school that I suffer from a royal's disease.
Yes, Arjun. Remember, there are two main types of hemophilia: hemophilia A and hemophilia B. Hemophilia A is the most common type and is caused by a deficiency of clotting factor 8. Hemophilia B is caused by a deficiency of clotting factor 9. There is also something called as acquired hemophilia. Acquired hemophilia is a disorder in which the patients who were previously normal start acquiring antibodies against the factor 8 or 9 later in life, due to which these patients bleed after an injury, as the clotting factors 8 and 9 gets destroyed by these antibodies. You are not alone, Arjun. Hemophilia A affects approximately 1 in 5,000 individuals, while hemophilia B is rarer, affecting about 1 in 30,000 individuals.
So, uncle, are there a lot of royals in India suffering from hemophilia?
As per the World Federation of Hemophilia 2020's report on the Annual Global Survey 2021, in India, the prevalence of hemophilia is approximately zero point 0.9 per 1 lakh individuals, while hemophilia A has a higher prevalence. India has the second largest number of patients with hemophilia A. This highlights the significant impact of the condition on the Indian population and the need for effective management strategies. See this chart here for your reference. The clinical presentation of hemophilia can vary depending on the severity of the condition. Common symptoms include easy bruising, prolonged bleeding from minor injuries, and spontaneous bleeding into joints and muscles. Bleeding into the joints is a major concern in individuals with hemophilia and can lead to chronic pain, joint deformities, and impaired mobility if not properly managed. Other clinical manifestations of hemophilia include nosebleeds, muscle hematomas, which means bleeding within the muscle, excessive bleeding following tooth extractions, minor surgeries, or major surgeries. In severe cases, individuals with hemophilia may experience life-threatening bleeding, such as intracranial bleeding, bleeding into the GI cavity, bleeding in the neck space, which is really extremely dangerous. The management of hemophilia involves two main approaches: episodic or on demand treatment and prophylaxis. Episodic treatment is approached when, in case of a bleeding event, clotting factors are given immediately to stop bleeding, thereby promoting the blood to clot quickly. On the other hand, prophylaxis involves regular administration of clotting factor concentrates to prevent bleeding episodes from occurring in the future. Prophylactic treatment has been shown to be highly beneficial in individuals with hemophilia. It helps reduce the number of bleeds, prevent joint damage in the long run, and improve the overall quality of life in people with hemophilia. By maintaining coagulation factor levels above 1%, prophylaxis can significantly reduce the incidence of irreversible joint damage caused by repetitive joint bleeds. Prophylaxis plays a crucial role in managing hemophilia and has several important advantages. By achieving higher factor trough levels, prophylaxis can result in fewer bleeds and healthier joints. This leads to a significant decrease in the number of bleeding episodes compared to the on demand treatment. Moreover, prophylaxis has been found to reduce joint damage, improve patient outcomes, and potentially facilitate an active lifestyle. It offers long term benefits by preventing further joint damage and ensuring individuals with hemophilia can lead fulfilling lives. The IV infusion treatment of factor concentrates on preventing the anticipated bleeding. The IV infusion treatment needs to be followed for 2 to 3 days in a week, depending on your condition. The health benefits of prophylactic dosing regimens for clotting factor therapy in patients with hemophilia include reduced joint